Good morning, everybody. My name is Jeff Twinning. I'm one of the clinical directors at Five Alice Physio Clinic. Today I want to talk about the spine. We see a lot of neck, shoulders, backs, and with the lockdown situation, the aggressiveness of these problems have been really significant. So people experiencing lots of arm pain, lots of leg pain, and just really acute episodes of their back and neck. Now, this may be an issue that they've had on and off for some time. It may also just be an issue that's quite new to them. I suffered myself doing lots of remote work during the lockdown period with mid-back issues. And the biggest reason is, we're working from office setups that we're not used to. The desk is different, the table height is different. We're using laptops and we're looking down a lot. All of these things that cause some variation in what we're used to. So today I want to talk about the spine and just look at the common misconceptions that people come in with. And the big one is sciatica. It's an umbrella term used really when diagnostically you don't have the correct underlying pathology going on. And ultimately, when people just have leg pain, it's thought of, I've got sciatica. Now, in the majority of people that we see who come in with that label, most of them do not have true sciatica, which is either the compression or the neural irritation of the sciatic nerve along some part of that route. So we like to go the extra mile, give you that precise diagnosis, and we typically look at this in a number of different ways. So sources of pain, where do they come from? Well, they come from the facet joints. Now, these are the small joints that sit either side of the spine all the way up. They come from the discs, which sit between the segmental spaces. And these are really what control, 85% of your spinal load in your back. And is often all ports of evil come from the disc, from a primary or secondary location. We also then have a neurogenic component, and this is where maybe, the exit around the nerve is affected. So that could be narrowing of the hole, that could just be compression. And then we also have the muscles that from our spine come up the side of the pillars of the back, and we call that a myogenic referral. So it's important to understand what is causing the leg pain, and that will then form the diagnosis of what we work with and what we rehab and hopefully what we resolve for you. So we have arthrogenic, neurogenic, myogenic and discogenic. So if someone is diagnosing you with sciatica, in my view, they're giving you the watered down approach, and they may or may not be right with their clinical assessment on that front. So once we know, and we know this from our testing procedure, we don't need an X-ray of every back. We don't need to MRI every back, even those who are really struggling with maybe acute neural pain in their legs. Our clinical assessments will give us the information we need, and we will only then investigate further if you're not improving, or you're worsening, or you have worsening neurological symptoms. So we will also always have those frank conversations with you about, why am I MRIing? Or why do I disagree with you that you want an MRI? And that's really important, rather than just saying no or yes or being patient-led. It needs to be professionally led. And this will be the same whether you're in the NHS, in a consultant, or if you're coming to see one of ourselves. So that's a quick overview of back pain in the lower sector of your spine. So if you're a sufferer, if you've been having treatment and someone's not giving you a precise diagnosis, they've given you the broad terminology, which in my view is a non-clinical approach, then maybe it's time to have a think about, how can I get rid of my back pain? We've got a great team at Five Alice Physio. We've got a clinic in Stroud and a clinic in Gloucester, and we have 11 therapists, all who are experts in their field. So whoever you see will get you back on the road. And if there is ever an issue or a very complicated case, we work together to form a really structured approach to your rehab, or we can refer on if deemed necessary, or you're possibly a surgical candidate. So check out our website, www.physio5.co.uk, and that will show you our services and our team, and you can look into each person's profile. Or if you've got a back problem or a neck problem or any other joint or muscular problem that you want to get fixed, then give us a call at 01453 755 948. We have a central reception. They deal with bookings across all of our clinical sites. So if you're Gloucester based and it's a Stroud number, don't worry. And we look forward to seeing you very soon. So keep in touch. Follow our Facebook page. We do lots and lots of videos that may or may not help you. And you can always contact us through either Facebook, social media, or our website if you want some communication in terms of your problem or whether or not we feel we can help you. We'll always do that up front and free of charge, first case. So have an amazing day, and we'll catch up with you very soon.